there. I'd like to welcome everybody to this webinar for the Region 7 Disaster Health Response Ecosystem. Today's webinar, of course, being on navigating the cybersecurity landscape. I have a couple of housekeeping procedures that we need to go through real quick, and then we'll turn it over to all of our panelists to walk you through this journey that is the landscape of cybersecurity. I am going to turn it over to Lisa to introduce herself and her team here and take it away.
Hi, thank you for joining us. So good afternoon and welcome to today's panel. We're going to discuss navigating cybersecurity landscape in healthcare. And we are thrilled to have you join us for this critical conversation about the evolving cyber threats facing healthcare organizations and the steps that we must take to protect the patient data, ensure regulatory compliance, and build a more resilient future. In a world where healthcare systems are increasingly targeted by cyber criminals, security leaders play a vital role in safeguarding not just data, but also patient lives. And today we have the privilege of hearing from three outstanding CISOs who are at the forefront of healthcare and cybersecurity, leading their organizations through complex challenges while ensuring that data privacy remains at the center of their security strategies. I'm Lisa Bezos. I'm the CISO for University of Nebraska Medical Center and Nebraska Medicine. I've been in the field for over 20 years, building security programs that integrate with compliance, risk management, and building resilient programs for infrastructure and applications beyond. Next is Melissa Rabel. Melissa, wave. Okay. She's a CISO from Children's Nebraska with over 30 years experience in healthcare IT. And her strategic approach to information security emphasizes risk management and fiscal responsibility. And she's been instrumental in developing and maturing a robust security program across various organizations. And then there's Mike. Wave, Mike. He's a senior information security officer at Boys Town National Research Hospital with over 13 years of experience in information security, GRC, and operations. His experience includes executive CISO consulting, PCI DSS auditing, HIPAA high-tech, and Federal Information Security Management, FISMA. He holds a Master's of Science in Management of Information Systems, Information Assurance, and multiple certifications. And finally, there is Kara Special, the CISO from Children's Mercy in Kansas City. Wave, Kara. She has over 25 years experience in information systems risk management, information security governance, business process improvement, and information technology audit experience. Kara spent most of her time serving in the healthcare and financial services industries, working as a consultant or a CISO. And she currently leads a team of over 45 professionals at Children's Mercy in Kansas City. So as you can see, between the four of us here, we have almost 100 years of cybersecurity and IT experience. So we are here to have a conversation. So we're going to bring together our wealth of knowledge and hands-on experience in a conversational manner. We decided to do this approach versus having slides, just because we didn't want to PowerPoint you to death and because we all like to talk. So we're going to open up the mics to this conversation because, as we all know, the healthcare industry is a critical crossroads where innovation and security must go hand in hand. As hospitals and healthcare organizations embrace digital transformation, leveraging cloud computing, AI-driven diagnostics, telehealth, and connected medical devices, the attack surface just continues to expand. Cyber criminals recognize the high value of protected information, and they make healthcare a prime target for ransomware, phishing, and supply chain attacks. Meanwhile, regulatory scrutiny is constantly increasing on us with evolving standards such as the HIPAA, NIST, CSF, and CMMC demanding that we take stronger security postures. So at the heart of all of these challenges lies one fundamental priority, which is data privacy. Patient trust is the foundation for all healthcare. And without robust security measures to protect the sensitive data, that trust is at risk. And we as CISOs must ensure that the security strategies are not just about compliance, but also about safeguarding the integrity, availability, and confidentiality of that data. So this panel is going to explore how healthcare CISOs can navigate this complex IT landscape, balancing the security with privacy, with patient care, and staying ahead of these evolving threats and building a resilient, privacy-first approach to cybersecurity. We're going to discuss key strategies for risk management, regulatory compliance, and secure digital transformation to prepare us for the future of healthcare security. Okay, so now let's dive into the discussions. So the first topic we're going to talk about is the evolving threat landscape and cyber resilience. So, what are the biggest cybersecurity threats facing healthcare organizations today? And what strategies have you felt have been the most effective in mitigating things such as ransomware? So, my panelists can just go ahead and unmute and then we'll just all chat.
I can jump in and start. I mean, ransomware is at the top of everyone's list. It's the buzzword, it's the keyword. It's got everyone's attention from the board down, to our users. And, we have to get to the users and help them with the awareness, approach, teach them, they're used to learning as doctors, nurses, they're sponges for information. So the more information we can get to them and help them be prepared, get that in their tool set, the better off we are. Our organization does everything we can technically, blocking millions of emails that don't even get into the organization daily, but we still have millions based on 8,000 plus employees and 21,000 identities with all of our volunteers and stuff that make it in. So we have to educate those end users and get them prepared to respond and know what to do if for some reason, it's not a if they click, it's when they click. What do they do? Our help desk, we're teaching them is our internal 911, if you will. That's the one-stop shop to call because you don't want to be calling me or sending me a message because I'm not checking those right now. I'm here with you all. And so you don't want to wait in that precious time to be wasted.
I
I would
would,
agree. I'll go, Melissa. Thanks. Um, so Kara's right on. It's ransomware, and that might seem sort of, I don't know if repetitive is the right word, but it's been ransomware for over the last 5, 6, 7 years, and it has not changed. It being ransomware at the kind of the top of the list has not changed. Ransomware itself has changed in the way that it's delivered, the way that it functions, the things that they do with it. In particular, in the last couple of years, prior to the last couple of years, ransomware was you get a virus, it encrypts all of your systems shut down, and then you get a ransom note. That still happens, but now there's also the data exfiltration and the data theft. So they extort you twice. They extort you once to decrypt your data, and then assuming that works, they will extort you then again and say, hey, we copied a bunch of your data, we have it, here's proof, and we'll put it on the internet unless you pay us again. And who knows, generally speaking, the paying the ransom does work. As much as we can all pound our fists on the table and say that we don't want to do that and we don't want to support that and we don't want to participate in that, the reality is that for the four of us up here, ultimately, it's not up to us. It's a business decision on whether or not they're going to pay the ransom and get back to business, frankly. Um, so yeah, it's still ransomware, and the steps that we have taken, kind of like Kara said, is primarily email. The biggest threat vector is still email. You want to train your users on security awareness training. You want to have regular phishing campaigns, which for us at Boys Town, we're social services and nonprofits, so we're a little softer. Um, and so I want to train our users. I do not want our users to feel as if the monthly phishing campaign or weekly or however your organization conducts it, I don't want it to come across as us versus them, that those mean InfoSec team is sitting in their offices conniving on ways to trick us. That's not the point. It should be a recurring reminder that this exists and to keep you vigilant and looking for those emails to prevent them from happening. And on top of that, the last piece on email security is that the email security products are continuing to improve. So adding AI to our security product solution set is optimistic. We're hopeful that that can help us identify phishing emails, scam emails even, and then of course malicious links and attachments.
now I would say everything that my lovely colleagues have said resonates with what we do here at Children's Nebraska. I would think one of the main focuses that we are taking in 2025 is really talking with our end users so that they understand what they would do in the event of a ransomware. So we're taking that along with the user education. So yes, these are the things you should do. These are the phishing, to get them up to speed so that they can readily identify those threat emails, and take the appropriate action and continuing that training. But then I also talk to them about when that happens and really pushing those end user responsibilities, like how do you operate? How do you continue operations? So putting those two pieces together, their security awareness piece, as well as talking about continuity at the same time, that's the approach that we're leveraging here. And that's our focus for 2025.
And I would echo what Melissa just said about the business continuity piece. So, as most people are aware, Nebraska Medicine was hit with a serious ransomware event in 2020. Lots of lessons learned based out of that. However, one of the things that we've continued to do is we've actually continued to drill at our director level and above, even to the chiefs of business continuity. And what does that mean? Because what we learned was we did drill a lot from a business operations perspective on can you write an order, but by golly, it was so interesting. Everybody forgot in 2020 how to actually do things without technology. So those are the types of things that we've been drilling down to the manager levels for them to take down for the business continuity piece. And then that kind of goes into a different little flavor of this, which is about third-party risk management. With so many systems becoming now SaaS-based, or we're more and more reliant on our partners and our third parties, they could get hit. And what does that do to us? Change Healthcare was the big buzzword last year for that event, and it affected a lot of us. So what are you guys doing to try to increase your resilience when you have these third parties involved?
I think from children's perspective is elevating what that risk looks like to those operational leaders, because what Change Care did is make them aware of that single point of failure that maybe they didn't have their arms around before. So we've taken more of a discovery approach to what does that look like. So I think we're very early and probably not very different than some of our cohorts in getting our arms around where those single points of failure are and what does that look like from a continuity standpoint, and how do you, much like how you would continue to operate from an on-prem or within your own applications, what does that look like with those third-party vendors, and what's the impact? So yes, we lose a Change Healthcare. I think if we had talked about that before, I think that they would have been, yeah, it's a few things. And then that turns out to be, wow, that scope is really large. And so I think those incidents really help frame the conversation and also the risk when you're talking with those operational stakeholders. So that's where we're going and the conversations that we're having.
As we've gone into whether it's like our ambulatory setting and presented, or even just different inpatient areas, we're like, where do you guys have vendors? And they don't really think about it, so we try and bring it to their level. And I ask the question, what do you use in your day-to-day environment that's not connected to technology? And I had one brave soul raise their stethoscope, just uncertain, and really then they started looking and they're like, outside of cleaning supplies, that's about it. And so getting them to think through and realize that this machine or that machine or this tool are all provided by a vendor, and that we're reliant on that vendor to understand what protections they have. We have to manage their risk. It's not just our four walls of the data center, because that doesn't exist anymore. And, we all have our specialty, if you will, that we think about. We think about cyber as a group on a day-to-day basis, but we have to also think about, patient safety and service and all of the things that we're impacting with security, and bringing that kind of in reverse back to our clinicians and saying, while you're thinking about patient treatment, patient safety, you also have to think about patient security of their data, especially, with children's hospitals. We have another layer because they're minors and different rules to also think about and play by. It's not just the patient data, but the family's data as well.
Yeah, for me, I had a real light bulb moment actually just this past year in our discussions about vendor risk management. We've got decent, robust processes like most organizations do. You onboard a vendor, you look at their documentation, you do a risk assessment, you look at what the risk might be. But historically, our sensitive data, most organizations' sensitive data lived in a data center inside a building that most of us was in our own building, and we managed it. It was our data center. As Lisa mentioned, a lot of our services, in particular, everything AI, is now SaaS based. And so the data is not in the data center anymore. The data is out in a hosted Epic instance. It's out in Workday. It's out in ServiceNow. It's out in various cloud instances that are not ours. And so the traditional cybersecurity methods of forgive the analogy of digging deeper moats and building higher walls to keep the bad guys out is no longer valid because we're backing cargo trucks up to the loading dock and loading our data in and letting them drive out the front door. And so those risk assessments, those vendor risk management, and where is our data going and what data is it and how long are they going to hang on to it and how are we going to get it there and how are they going to encrypt it and when are they going to delete it? Those are all questions that have to be answered as we engage and contract with new cloud-based vendors and SaaS solutions and third parties and contractors and software developers from foreign countries. All of these things are real and have happened.
We could write it.
Yeah, and
No, go
oh,
ahead.
sorry. Well, I tell the people all the time that, when COVID hit, we went from having our big, nice moat around our organization and healthcare organizations. We were, in the office all day long. We didn't do remote work hardly at all at Nebraska Medicine. And we went to all of a sudden having, 20,000 satellite offices, right? And so all of those challenges, but now we still had our data center though. Now we don't have, to Mike's point, our data is not in a bubble anymore. It is all over the place. And how do we ensure that we understand the risks of our data being there, right? And then what does it mean to the people in the process and all of the technologies that we need is always evolving. And it's very interesting to hear people who that light bulb hasn't hit yet, right? That our data is not in our data center anymore. And if we're looking to the future and how to navigate this new landscape, I know Kara down at Children's Mercy, they're doing a huge lift right now to take almost everything from on-premise to a cloud of various versions. Mm-hmm. They're not even going to have their data in the data center, right? And so that's a whole new paradigm, and it's a reality. It's not a good or a bad reality. It's the new reality. And if we're going to modernize, that's where we need to go. And how are we going to take our stuff and go to it? You can't treat it like it is in our data center. It's new technologies, it's new thought processes, new thinking, it's new vendor risk management, even.
And it even goes down to new contracts and contractual terms. We had a lot of fun with Kronos a few years ago. Continuity plans, you pay them to track your time and attendance. And, what's your backup plan? And are we building on the fly, to have something to be able to track during the holidays, during crazy PTO time, during the, high census time. I mean, we had all of it at one because we were, that was November, December, January, 6 months plus of all of our lives. And as we started talking, we're like, okay, as we recontract and we move to the cloud, we're paying them, but do we ask for terms in our contract to have access to a copy that we can install on-prem or in one of our clouds as our continuity plan? Because at that point we were dependent on them, and that wasn't something that was standard in our contract to be provided. And we weren't going to build something. Why would we build and keep something on the shelf when we're paying them to do that for us? So those conversations from a business continuity have gone down into the contracts of what do we want them to provide? How many copies, single, double, tertiary, where are they all stored? Expanding that and making sure those are in contract terms as well. Because if it's not in the contract, you find that it's not going to happen.
Well, and Lisa, I thought you summarized it great at the beginning, just the ever expanding risk landscape. And that's exactly what it is. The landscape, we just are like real estate developers. We want to go grab more and more territory to spread that data to. And so understanding, I was going to say we could write a children's book. It's like a bad, scary infosec security book, but where does your data live? And, where is it? And then what's your contractual obligations around that? So I think all that goes to that maturity as we, before when we talked about infosec just being in the four walls, now our jobs just get infinitely harder as we bring on all of these new vendors.
And so that kind of leads us into the next.
I was gonna say, you can tell we work at the Children's Hospital because we're writing children's books. We're not writing any educational books for the adults.
All of you are in the children's world.
Yeah.
So it goes into the next question is, how do you manage compliance with various frameworks, such as with the HIPAA, NIST, CSF? If you're in any research land like we are subject to CMMC compliance and all of this. How do you align your cybersecurity initiatives with broader organizational risk management to be regulatorily compliant?
I'll go. So at Boys Town and Boys Town National Research Hospital, for anyone on the call who is not aware, we're much more than a hospital, right? We're a literal town. We have a municipality, a high school, a school district, a police department, a fire department, a farm. The list goes on. And so our regulatory compliance is incredibly complex. I do view it as a little bit like an inch deep and a mile wide. We're subject to everything. I used to joke that the only two we didn't have was FCC because we didn't have a TV station, and FAA because we don't have a helipad. But the high school just got a radio station, and so now we're in there, and now we just need that runway at the hospital. So for me, it is incredibly overwhelming. I think we have over 300 federal and state laws that we have to document and comply with. A GRC tool, a governance, risk, and compliance technology platform is crucial, and you need at least an FTE or a team to manage that tool so that you can, what I like to say is audit once and attest multiple times. So I collect the evidence of all of the good things that we do, all of the processes and the documentation, the audit reports, the penetration testing reports, the Vuln scan reports, all of the documents and the evidence and the artifacts that we need to sort of prove our compliance. And you put those in the GRC tool. And then whatever law or regulation or compliance obligation you have, that one piece of evidence can then attest to multiple at a time. But it is complex and it requires trained professionals, candidly. So that's how we approach it.
I think in addition to the tools, it's the people. We partner with our enterprise risk management team, which is part of legal, and our regulatory compliance team and our audit team that we have internally, and then also leverage vendors to help us with a variety of those reports, whether it's the attack and pen. I mean, we have teams that do some of that on their regular role and responsibility, but you don't want to get lax because it's something you see every day. We want that third party outside opinion and those additional eyes on it. So in addition to all of the things we do internally, getting those assessments of ourselves helps with that compliance as well.
And then the piece I would add is just roll up that, get that visibility at that senior leadership level to demonstrate where you're at with your compliance initiatives. And I think that's been a key piece so that resources can be allocated to those areas that we have gaps. So I closely partner with our audit team for that exact purpose. So we can elevate those risks, the defined risk areas, and then look to, where do we want to do as an organization? How do we want to bridge that gap? What resources can we bring to bear to close it? So that would be the other piece.
And to piggyback off of that, before we move on to the next one, I've always said too that internal audit is your friend. A lot of people look at it the opposite way, but I try to befriend them because anything that is identified, we have the opportunity to create corrective action plans and to elevate it to leadership to say, do you feel this is worth fixing or not? Because that's not my role is to identify the risks and to provide the solutions for how I feel we could mitigate the risk. It is really the business's responsibility to handle that. And so we've really elevated all of these conversations to up all the way up to the board to have them decide whether or not the juice is worth the squeeze for us now. And it's somebody else's decision, not mine. It's actually really eye-opening when you shift the responsibility of assuming risk. It's amazing how things all of a sudden start working.
I do feel, Lisa, I do feel one of us has to say that compliance and security are not the same thing, right? There are tons and tons of laws and industry regulations, HIPAA, high tech, PCI, you name it. and they're all out there. But the reality is, if I'm going to take the filter off and be a little more candid, is we do what's mandatory for our compliance reporting, you know, our annual PCI attestation, our annual HIPAA security risk assessment, among others, and we manage those well. But what are we going to focus our efforts on and what are we going to work on? That is a risk-based decision that your organization needs to make between your risk group, your executive leadership team, based on size, cost, and complexity. Where's our risk at? Just because the next new shiny law just got published or ratified does not make it the highest priority. It may be out there, but we're going to evaluate it. What does it require that we're not already doing? Let's risk assess that. Is that more important than the things that we've already identified as high risks? Or are we going to continue working on the things that we've already prioritized? So that's really how we focus on moving the needle on reducing our risk of a data breach.
Well, we don't
Go ahead, Melissa.
have unlimited resources. So no organization can resolve 100% of any risk. And so I think that that's important that people understand that those are risk conversations, and all business accepts some level of risk. So it's just whatever that risk appetite is and whatever resources they have. Sorry, Kara.
I was going to say, you can be secure, but not compliant. You can be compliant, but not secure. And in some cases you can be both, but you have to get down to the details and know your audience to be able to get that message across. Because in some cases it's, you know, people are like, just check all the boxes, and you don't and can't necessarily check all the boxes because of the resources, because of the decisions, because of the risk factors involved.
And with CMMC compliance regulations coming out from government grants, they've made it very, very clear that we better not be checking the boxes and signing our names, because they're going to come check us. So that's an interesting flip at the university, because they're like, oh, just sign this. Just sign this. They've never asked for your signature before. And I say, oh, contraire, I don't sign things unless I believe in what I'm signing. So it's shifting the narrative, and it's in a good way to make things secure and compliant, but it's also changing the narrative from what people are used to before, because they could self-attest. You didn't have to have somebody coming after checking on it. So as organizations adopt new technologies such as AI, the buzzword of the year, more cloud-based systems like we've talked about, telehealth, remote patient monitoring, IoT medical devices, all of these things that are just booming. What security considerations should you prioritize when you're working with your business units on wanting to bring in the next new shiny object?
I think from that perspective, it's understanding that, you know, if you put it in the cloud or you're going to, you know, the next technology, it's still your responsibility, that you're not passing the buck off to someone else. And often they're like, oh, well, we don't have to deal with this internally anymore because it's not in our four walls. Having that clear delineation of, we still, as the organization that's owning the contract, the technology, and using it, have that responsibility. But then what is the responsibility of that third party, which goes back to our prior conversation in the contracts? Are they responsible for keeping the servers updated, or is that on us? And making sure that, you know, everyone understands that. A lot of times we see people go to conferences and they're like, ooh, the shiny new, you know, glitter squirrel or whatever that shows up. And they're like, I bought it while I was there. And you're like, what's it solve? You know, what are we trying to solve? What's our problem? Do we already have that in place? And, you know, not getting caught up in the newest, latest, and greatest, as Mike alluded to. You know, we're going to look at it, we're going to analyze it. What is the problem we're trying to solve versus just getting what someone's trying to sell us?
We hammer a lot on access controls. I mean, because a lot of the vendors that some of these smaller organizations, if you will, SSO, single sign-on, seems to be a unique concept to them. And so that's a big challenge for us, because then we go back to the business units and say, then that means you get to manage those individuals that are accessing the software. So we talk a lot about access controls, also encryption, and really getting into those conversations with some business units, because, you know, it'll be sold to them that IT doesn't need to be involved. And so if we want to, cut out IT, you need to understand these concepts with this vendor that we're entering into this relationship with. So talking about data storage, access control, encryptions, things like that, then they realize that it's good to have us at the table and to have those conversations.
That's exactly right, Melissa. It's good to have InfoSec at the table. One of the challenges in most organizations that I've seen is at what stage do you involve the InfoSec department, right? And if there's what we call demand management, hey, I've identified a problem that we want to solve, and I think technology can help us solve it. Okay, do we involve InfoSec right now at the writing of the RFP? Do we bring them in once we think we've landed on a top three? Do we bring InfoSec in once we've decided on a technology, only to have InfoSec tell us no, right? And then we got to backtrack. So deciding that point is crucial. Also, vendor security by contract, because we're still talking about third parties here, right? We're talking about widgets and solutions and MRI machines and whatever else. And for any of our healthcare providers out there that want to, buy a new widget and bring it into the organization, one thing that I've seen happen in the last year that our biomed team and our IT folks have identified is a business user or a department will go buy a widget, right? For us, we do a lot of audiology, so hearing aids or hearing testing things, and they neglect to identify that technology, that piece of hardware, that physical widget that they're going to hold in their hand runs on software. And that software has to be installed on a server in the network, on the data center. It has to get its updates. It has to be managed. So don't overlook that and don't neglect the security by contract. And I would also say that it's very crucial for us in the information security industry and in partnership with our legal and compliance friends to push back on those vendors, those device manufacturers, because just candidly, cybersecurity is not their priority. Their priority is to get the widget built and get it sold and out the door. And then we go in and look at it and we go, my goodness, you have default passwords on this thing. It doesn't get proper updates. It's not well taken care of. It's horribly insecure. Hey, manufacturer, that's on you. And you've got to get it fixed. And we as an industry have to push back on that.
Yeah, I would also sorry,
No.
we give it a pause. I would also say that I think that partnering with InfoSec before a contract is signed is really your best bet. So you get it down to, so if Mike's throwing the question out there, but if I would advocate, I would say when you got it down to one or two, our team will look at a couple of them, and that way you could have a bake-off, and we could show you, here's the risk that you would propose, this proposed solution would bring to the organization versus this one. So not all vendors carry risk, but most of them have some flavor of risk to them. So I think that if you put it that way when there's a couple before you go to contracting, because once they sign the contract, they're really not that they're not that motivated to resolve maybe issues you may find.
And I will say, reach out to your friends. You can reach out to any of us too. Do you use this vendor? What have you found? Because what we find a lot is, I just went to HIMSS a couple weeks ago, and in talking with some of my colleagues, they all feel the exact same way we do. All of us know, and Melissa and I have talked numerous times, we have our vendors that we don't think play nicely in the sandbox. But yet they're the only people that do this certain thing. So we're forced to take on those risks, but we need to make sure that the business understands that we're taking on these risks by allowing this niche vendor. And as things become more of serverless compute, and that's funny you say the word widget, Mike, because that's what I say all the time. I'm like, these aren't even programs or applications anymore. They're widgets that we are buying or installing or subscribing to or helping to create. And they're all really useful, but we have to make sure that all of a sudden our data is not going every which way possible and that's contained. So a little bit of a shift, I guess, but kind of on the same line. So as we have all of these providers and business departments going and finding the next shiny object and the next toy, how do you then take them and foster a strong security culture amongst your leaders in your organization so that they do bring you to the table and they ask your advice before it's at the 11th hour?
We try and build relationships in advance to become that trusted advisor across not just cybersecurity, but information systems. So we're not kind of flipping the script from being the order taker of, hey, this is what I bought, now go do, to how can we help you improve your processes, your effectiveness, your efficiency, while also, in my case, being secure. And building those relationships, talking to them up front before they're even thinking about buying. I just had that this morning. I had someone call from our pharmacy team. We have a huge lift, system changes, and they're like, we want you to plug in early so that we're prepared, because we know we have this compliance review. We know we have this specialty pharmacy certification we need, et cetera, et cetera. And so they came to us and said, hey, let's partner early, because we've been meeting with them. We've been having those conversations versus, hey, we're ready to go live on 3/27. Now we need cybersecurity to help us.
Yeah, I would say for me, relationships 100%. Like if you don't start there and you've already got a bad foundation, I would say regarding metrics, right? In building a positive relationship with your executive leadership team, board of trustees, whatever it is, information security, cybersecurity, and risk are really, really hard to measure. Hey, Mike, what's our risk today? 7, right? Out of what? I don't know, 10 or 100. We don't know. And it's a moving target. I could feel really, really confident today and then read a news article and that goes, out down the drain. And all of a sudden I feel really, really not confident. So it's a moving target. And so for me, it's less about having quantified cybersecurity program efficiency KPIs. Well, I have them, and those are good. I really like the maturity model. And I'd much prefer to answer the question, are we doing the things that we should be doing and how well are we doing them? Versus give me a number, right? Give me your information security credit score. That just doesn't work and it changes too rapidly. So I like to do that. And then the last thing for us in information security leadership is the ability to tell a story. Whether it was telling a story of what happened to another organization and how it impacted them, how they recovered, what has worked, what has not worked, what could possibly happen, while balancing the Chicken Little effect of you don't want to be worst case scenario all the time, but then you're negligent if you don't at least address the possibility of the worst case scenario. So you don't want to be alarmist, but you want to be properly informing people. And so the ability to tell that story and articulate well is crucial to, frankly, maintaining those relationships. Otherwise, you become untrusted, right? If you're always the person screaming that the sky's falling, all of a sudden they don't trust you anymore. So you kind of have to be able to explain yourself and tell the story well.
I would agree with that. And I'd also say share lessons learned from other organizations' challenges, if you will. So, unfortunately, our industry is targeted. And so there's lots of use cases and case studies that we can bring to the table. And I like to leverage those, to your point, Mike, to not sound like an alarmist, to really just talk about these are some gaps that this organization unfortunately were either not able to mitigate or aware of, and this is how we can be, get more visibility to that. But to the original question, about how you bake in, cybersecurity into those, vendor management conversations, we at Children's started an enterprise opportunities management gate, basically. So if you have ideas, if you have projects that you want to bring forth, we really have a lot of support with leadership about directing those through that process. And information security, legal, compliance have seats at that table. And so I think that's, to Mike's point, getting maturing your processes. The KPIs are great. They're good. To your point, some days really great. Some days will look amazing. Other days it's like, well, everybody clicked on that. So I think, I think that having those processes to bake InfoSec in, I think personally InfoSec and procurement should be the best buddies. InfoSec and finance, when you come to like new vendor acquisitions, baking your processes in with that is super helpful to make sure there's a check before either a contract is signed or something is paid.
While we're here, we did have a question pop up. What key items, language, tactics are best to be used to get better buy-in from the C-suite? We've talked about the metrics and we've talked about, I think we all present to the board on a regular basis, and it's really, like Mike said, it's telling that story, making it relatable to them. We've gone down to everything, using examples of house fires or using examples of neighborhoods with streets and fences, something that, everyone, no matter where you are coming from, background wise, education wise, can relate to, and bringing that kind of personal aspect in.
When we had the incident in 2020, we were really working closely with our partners from both the academic and the clinical side. And everybody wanted to know, what do you need to stop this? And so I was like, oh my gosh, they think we have a shiny object, right? That can just stop everything. And so that really took us like, oh, we need to change this perspective, to your point of how does this really work? And so we created we have the fire analogy, right? That, you buy insurance on your house, you make sure that it's built to code, you do all of these things, but yet you can still have a fire. So what do? Well, you have fire detection mechanisms, right? You have smoke alarms, you have fire extinguishers, you can use water, you can use, flour if it's a grease fire. There's all types of things, and not everything works for everything. And when we explained that, their eyes were like, oh my, I didn't think of it like that. And so I go, so we then talked about, from our perspective, I made it be like an ecosystem. So I said, you have just for a regular interaction with an electronic system, you have a user. That user connects to a device, whether it be a phone, a computer, something. They launch that with that device connects to a network, whether it be at your home and then VPN in or on campus, something, and it launches an application. That application lives somewhere, whether it's in your data center or the cloud, and then it has data behind it somewhere. We have to have protections around every single bubble and every pathway through, and based upon the risks in the articles that Mike reads in the day, it might make him shift a gear. And so I always talk about the stair stepping and the gears. And I say that's why this is a program, not a project, because the project will never end. There'll be a new thing that comes in, and we're constantly shifting. So I tell my leadership all the time, you will never hear me. I'm not going to tell you the doom and gloom, but I'm not going to also tell you that we're safe. We are safe today at this moment when we have our daily shout out. And I tell you, how many days it's been since the last user has been compromised or device has been compromised. That's what we have to report out every single day to our enterprise-wide daily shout out that comes up. They want to know, how safe are we? And so that's what we do. We count backwards. When was the last time a user gave out their credentials? And when was the last time we had a device that was compromised? Now, all that tells you is we have tools to mitigate things, but it also tells us when the human factor is in play, right? The last time we had a device compromise was because somebody thought they needed to get a new PDF viewer. Well, we have enterprise PDF viewers. They're on every one of your workstations, but she thought she had to go Google for this and downloaded it. And of course, our tools caught it. It didn't cause it, but it still triggered it, right? So that's how we really measure our safety numbers backwards that way. But to your point of even metrics and reporting to the board, you need to be very, very careful about what you're reporting on, because I always tell people, I kind of chuckle if people present how many emails did we block or how many things did we block on our firewall, because those are really irrelevant. It's the one email that got through, right, and it's the one thing that got through your firewall that matters, that you can't measure. And so we just say, are our systems working as designed today? And we say whether or not we're safe or not safe, those types of things. Because, there's tools that go down, there's tools that have issues, there's tools that have bugs. And every day we're constantly, again, shifting the gears. But that's how we frame it and say, if I need to bring in a new technology because there's something that's come up that's riskier, I frame it in that aspect of that. This is the gear that I'm shifting. This is why we're shifting this gear. This is why we need this. Or in our newest thing that we're doing this year is we're really talking about data and data security. And I make the analogy of my closet. I have a closet that has a lot of clothes in it. I don't wear those clothes. Some of those clothes don't fit me, all of that stuff. But that's kind of what's happened to our data in most organizations over the last 20 years is we just keep adding to it. And then if we fill it up, we just go build a new closet, and we might actually have the exact same clothes in both closets and we don't even know it, right? So we're really doing our big strategy for this year is to have a data, we're calling it, a purge. We're going to Marie Kondo our data, and do we love it or not? And if we don't love our data anymore, we're going to delete it, and we're going to start over fresh, and we're going to start data tagging. We're going to start putting the retention policies on. We're going to do all the things that we can technically do to try to contain our closet. But when I say this, and the point of my story is that when I say these things in these terms, everybody can relate to it, right? If I just start talking about data classifications and is it high risk data and what are we going to do and how do I do data loss prevention, nobody's going to listen to me. They're going to just tune me out, right? But they can then take an ownership of their data, start tagging it, start doing things so that we don't delete it. But then they can say, oh yeah, I don't care about that, So we're really trying to involve people at the personal level, to your point, because not everybody, I have to remind my team all the time, while what you do every day is highly, highly, highly technical, that is not what the majority, or at all, 90 some percent of our workforce at our hospitals are not technical. They are here to provide care for people. I do not provide care for people.
Yeah. I'm going to jump in here. Angela, I love this question. It's probably my favorite one. And here's where I'm going to go with it. Kara mentioned that you have to build a relationship, and building that relationship with your C-suite is crucial because for a million other reasons, but because you're going to learn your C-suite overall, your big picture C-suite, your board, whoever, that they've got a particular culture, right? And a way of looking at things. If they're heavily financially focused, then maybe your messaging needs to be financially focused. I try to avoid talking about cybersecurity in the frame of reference of money at all, because I use this phrase all the time. No one cares how much money you saved when the data center's down on Monday. It does not matter, right? And the other thing is, coming into cybersecurity and saying and pushing cost savings, just that can turn on a dime. Your next renewal might be 150% increase, and all of a sudden that's gone. And now what? You did a bad job? I hope not. So a couple of things. One, we talked about telling stories. You've heard all four of us up here give silly, corny, ridiculous cliches. It works, okay? It conveys the message because it avoids all of the jargon that we use in our day-to-day, right? If you go to Black Hat, sure, throw all the jargon you want, but if you're talking to a physician and you're going to talk about DLP and encryption mechanisms, no thanks, right? You've already lost them. So use the cliche stories, the ones that you like, that convey the message that you want. Pick them up from people like us, from webinars like this. And if you hear a good one, write it down and remember it. Avoid jargon. For me, I try to avoid talking about price and cost. And then I'll give you one example of one that I just recently used, and it was one of those ones where I said it and I was like, oh my God, that's genius. I'm going to use it. Okay, so we all talk about cyber hygiene, right? In information security, we talk about cyber hygiene. Like Lisa just said, we have no silver bullets. There is no $1 million purchase that's gonna make us secure. We have to do the small things every day, and everybody has to do them right for it to work. Guess what? Hygiene translates really well in the healthcare profession. So I was talking to one of our physicians, and I said, if you have a patient who is otherwise healthy but obese, you're going to tell them that they need to eat their vegetables and get some exercise. And guess what? They're probably not going to do it. And is that frustrating? It's horribly frustrating. And for us, I said this to my CEO. I said, listen, everybody that I talk to in our organization, including our C-suite, is, yeah, InfoSec. You guys are great. We know how important it is. We support you. We want you to be successful. You guys are doing a great job. InfoSec is a number 2 priority in the organization right now. Okay, I'm going to need you to change your password. What? No. Hey, we need to reboot this machine to get it up to date. Absolutely not. Let's do it next week. Oh, you mean like getting your exercise? Let's do it next week. So it translated, right? As I was talking to this healthcare professional about hygiene and health, and I said, Here's the one-liner. Everybody wants to be secure, but nobody wants to do secure things, right? Nobody wants to be the person who has to hash the machine or change the password or use the MFA token, because those things are inconvenient. They're not fun, just like vegetables and exercise. So it translated really well. I loved it. Use that one.
Well done, Mike. I'm writing that down.
So as we start to wrap up here, I'm gonna kind of jump to the end of our questions. But what advice do you have for the next generation of healthcare security leaders?
Boy, never stop learning. I mean, literally, yeah, I learn something absolutely every day. I think that if you're in this field and you think you know everything, then that's a very scary place to be, because the world, it just is phenomenal how fast it's changing. The things that keep me up at night is everybody's excited about AI, but I'm like, with every good that what is it with every good thing, there's like a negative consequence, and the bad actors are using that too, and the ability to reverse engineer software and for vulnerabilities, that's scary, because these vendors that we've already talked about, we don't feel do a good enough job with security as it is, and now to have them really targeting some of our weakest areas, our point of care devices, and using that technology to reverse engineer that those are scary things. So I would just say continue learning every single day.
And I think to add to that, we're seeing, I mean, there's a lot of people that are, security is the buzzword. People are now interested in it. There is no traditional or standard path to being a security leader. I bet if we all went around, I mean, you saw we all had different years of experience, we all had different focus or background, and we all bring different aspects to the table. So, I look at my team that I have, and I have people that you would have never thought would be a security professional based on what they went to school for, but they were curious, they were inquisitive, they never stopped learning. And they're some of our best security professionals because they think logically. We've transitioned people from internally, they were our like a service desk person, because they're used to asking questions to try and triage and answer. Our clinicians and informaticists, same way. I mean, they transitioned from the clinical side because they were curious, they asked the questions, and they wanted to learn. And so, I would say don't ever rule anybody out, as you're getting resumes or whatever, just because, they don't, check what you think should be the 3 boxes to be a security leader, because there's not any standards out there or any standard one size fits all.
I would say my advice to the next generation, on top of what the other two ladies just said, absolutely agree with those. My advice is don't get cynical and don't get jaded. Information security is rough. It really is, and maybe you can hear it in our voices. The longer you work in InfoSec, you will start to get jaded, and you need to be able to recognize it in yourself and not let it impact your performance. It's important to take an opportunity at least once a year. I try to do it quarterly, to do a look back at everything you've achieved. Because if all you're ever doing is looking forward at all of the things that are broken and all of the things that are risk and all of the things that can go wrong, you will get jaded. You need to look back and go, but look how far we've come. When I started at Boys Town, we didn't have MFA. We didn't have photo ID badges when I started, right? And so let me take a look back and go, okay, we've come a long way. We've done a lot of good things, and we have a lot of things to work on. And also get out of your environment every once in a while. Webinars like this, go to a conference, get reinvigorated about what's possible, what can be done, what's new, what's available, meet some new people, talk about what's worked, get a little bit of positivity. Otherwise, the job can feel futile. My brother works in IT, and he tells me all the time, if they gave me $10 million, I could make everything about IT in this organization work like a clock, and it would be perfect. But if you gave an InfoSec person $10 million, Lisa, would you say we're secure now? No, you wouldn't. And so that can just feel futile, right? It's like no matter what I do, it just feels like we're never going to get there. And I got bad news for you. You're probably not ever going to get there. All you got to do is like Tetris and golf. All we try and do is get better at it. You don't win. You just try and get a higher score every day. So that's my advice is check your attitude because it'll wear on you.
Yeah, and I think one of my final statements about this too is not only do you be a continuous learner, I don't ever pretend that I know everything either. But if I don't know something that somebody just told me, I will write it down and then go figure out what are they talking about from the lens that I would care about. Another thing is friends. We have friends. These are my friends. We know people, we meet people, and we have them in our playbook for a reason. Because when you have an event that happens, you're going to need your friends. So when we had our event in 2020, I literally got a hold of Melissa and Mike because they're in Omaha with me. And I said, Houston, we have a problem. This is what we're seeing. I gave them indicators of compromise so they could stop threats before it even happened. That's how we have to work together as the entire community here. And that's what we're really here for all of you, is to help build your network of friends. Because again, too, if Melissa's bringing in a new lab system, she can phone me up and say, hey, do you have this? What do you think? How did you work with this vendor? Because again, some vendors are not that easy to work with. And we have tips and tricks on what we said to them to help get it into our environment. Okay, well, with that, we've covered a lot today. I think I'm down to a minute and a half left. So from the evolving cybersecurity threat landscape and regulatory challenges to securing digital transformation and preparing for the future, one key takeaway from this discussion, I think, is that cybersecurity healthcare isn't, again, just about compliance. It's about the trust and patient safety and resilience. And how do we do everything we do every day to keep that patient trust and to keep our systems resilient so that Mike's brother in IT can keep the lights on and keep going, right? How do we build those networks, build those relationships to make it a cohesive, positive environment for everyone, so that, because we do not want to be the bad info security cops. We don't want to be the people in trench coats walking around. That's not what we want. We want to partner with our friends, and we want to partner with the business to make sure that everything is safe and resilient. So I have a huge thank you to all of you guys for joining us in this webinar today. I'm sure we'll be calling on you again because we like each other. And then we have more topics, I think, coming up. I don't know if Thomas, if you're going to talk about, I think we have a couple more webinars coming up this year too.
Yes, actually, so we do have a couple of other ones coming up. We're going to have one, I have it down for in June, talking about cybersecurity around medical devices, specifically around medical devices, because that's been kind of a hot topic as well. And then later on in September, we're going to use one as a kickoff for Cybersecurity Awareness Month, which is in October. So we'll have it ahead of time there to be able to kick it off. I want to thank all of our panelists today. I thought this was a great discussion. A lot of information thrown out there. So again, we thank everybody for joining us. Thank our panelists, and hope to see you on some of our future webinars.
Thank you.
Thanks, team.
Bye-bye. Thank you.
That's all.